Good morning, everyone. I would like to welcome all committee members, staff, and guests to the February 24th, 2025 Haldeman Norfolk Health and Social Services Advisory Committee meeting. I would like to remind everyone that our meetings are web streamed. With that, I call the February 24th, 2025 Haldeman Norfolk Health and Social Services Advisory Committee meeting to order. Are there any disclosures of pecuniary interest? Seeing none. Are there any additions to the agenda? I don't see any. Thank you. Adoption of advisory committee minutes. Health and Social Services Advisory Committee, January the 27th. Oh, sorry.
I'd like to put a motion to amend the agenda and deal with item 4.1.2 first so that we can have that one resolved.
Oh, sure. Thanks, Chris. I appreciate that. So amendment to the agenda. Can I get a mover and a seconder, please? Moved by Councillor Van Passen, seconded by Councillor Metcalf, and that is all in favor. Thank you. So may I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory Committee meeting minutes from the January 27th, 2025 meeting? A mover and a seconder, please. Moved by Councillor Van Passen, seconded by Councillor Van Riesche. Any discussion? All in favor? And that's carried. Thank you. Moving on to 4.1.2, HSS 04004, HNHC Ramsey Drive, Build Service Manager Consent and Last Mile Funding Update. I'll introduce Amy Vesperini. Thank you. Supervisor Financial Planning and Reports. Go ahead. Thank you.
Thank you, Chair Bentley. I will be presenting this report. As part of the renewal and regeneration strategy brought forth by Haldeman Norfolk Housing Corporation, the sale of rent geared to income units to be replaced with the construction of new buildings containing rent geared to income units within the Haldeman Norfolk portfolio was presented. The construction of a housing facility on Ramsey Drive in Dunnville is one of these projects. This project has been in the works for a number of years with the approval of Haldeman County Council. On October 29, 2024, Haldeman County Council approved the revised plan for the construction of this facility, with 56 mixed income tenancy units and 2 commercial units. Of the 56 units, 14 will be rent geared to income, and 28 will be affordable, 14 will be market. HNHC has already disposed of 11 and will dispose of an additional 3 RGI units in Haldeman County, resulting in 0 net new RGI units, but new units. The 2 commercial units, one will be a child care center, while the other has yet to be determined what business will be renting the space. Additional details on what was presented to Haldeman County Council can be found in Attachment A. The capital costs are anticipated to be $29 million, $356,000. Operationally, the project is anticipated to be self-sustaining based on the rents collected from the mixed unit approach. The funding for this project will be provided by Haldeman County and grant funding. However, finance staff would like to point out that the amount of 4% rent being put into reserves is not sufficient to support major capital requirements through the entirety of its life or the eventual replacement at the end of the asset's life. Additional details on the financials are also included in Attachment A and B. As presented to advisory on January 27th, Norfolk County, on behalf of HNHC, applied for the last mile grant funding opportunity. On January 28th, the province announced that Norfolk County, as the service manager, was successful in their funding application. $2.3 million will be used towards the Ramsey Drive project. However, as this funding cannot be stacked with the existing Canadian Ontario Community Housing Initiative, or COCHI funds, the $250,000 originally allocated from COCHI must be found from another source. If another source is not identified, Haldeman County will need to provide the funds for this. As the Ramsey Drive facility will be added to the housing portfolio, Norfolk County, as the service manager, is required to endorse this project in order to accept the last mile funding, which will support the capital costs for this build. Thank you, and I'd be happy to take any questions.
Thank you. Is there any questions? Seeing none, the recommendation on the floor is that report HSS 25004, HNHC, Ramsey Drive Build, Service Manager Consent and Last Mile Funding Update be received for information, and that as the service manager, Norfolk County Council endorses the Haldeman Norfolk Housing Corporation's Ramsey Drive Build in Dunnville, and that Norfolk County Council accepts the last mile funding from the Ministry of Municipal Affairs and Housing in the amount of $2.3 million to support the Ramsey Drive capital build. And further, that Norfolk County work with Ross and McBride on a contribution agreement with HNHC regarding the last mile funding. May I have a mover and a seconder, please? Moved by Councillor Metcalf, seconded by Councillor Van Passen. All in favor? That motion is carried. Thank you. We are now going to go into 4.1.1 HSS 24005 Homelessness Prevention Program. The report is being presented by Louise Lovell. Thank you.
Thank you, Chair Bentley. Thank you, everybody, to have us today to present HSS-25-005, which is the review of the Homeless Prevention Program portfolio. I'm going to give just a really quick brief background to remind everybody about the reason this has come forward, and then I'm going to pass it over to our consultants, Help Seeker, and Dr. Alina Turner, so that I leave back as much time as I can for her to present to you before Councillor Van Der She might have to leave. This review was brought forward in 2023 when there was an increase to the funding portfolio for the homeless prevention program. The last review had been done in 2016, and we had implemented many modernization and different projects and initiatives in line with that first review back in 2016. When we received the funding increase, we recommended another review to make sure that there is confidence in the community that we are moving forward with best practices and streamlining and coordination of homeless prevention services for Haldimand and Norfolk. So with that, we used the RFP process. Help Seeker was the consultants awarded this contract. And again, with that, I leave it to Alina at this point to bring you the summary of their findings.
Good morning, everybody, and thank you very, very much for having us on the agenda today. If I am able to share my screen, that would be fantastic. And it looks like I have powers. There we go. Can everybody see my screen yet, or not? Not quite yet. Not quite. Yeah, let's try that again. Are we good?
Not
Can
yet.
everybody see the screen?
No,
Yeah?
we
Okay,
cannot.
No? Oh, darn. Let's try that again. Or maybe, Jill, are you able to share your screen? It might be something technical on my end.
I could certainly give that a shot. You just let me know when you want the next slide.
There we
Alina.
go. We got it now. Oops. There we are.
Okay. Great. Thanks so much, Jill. That's why we have multiple people with us. There we go. Okay, and I'll let you know when to move the slides. So as Louise perfectly summed it up, we had taken on a review of, again, available information, administrative data, and some of the huge amount of document and data that the team had been collecting. And we wanted to give some context on, first, why we're doing this work now, and why there's some important pressure points that are coming up ahead for you guys as well to consider. So there is a broader, as you know, housing affordability challenge that's at the forefront of some of the national debates and provincial election debates as well right now. And that's primarily entwined with some of the rural area growth that we've seen in homelessness, and specifically hidden homelessness as well. So hidden homeless, if you're not familiar with the term, it's living on friends' couches, cramped beds, makeshift living arrangement on farmlands, etc. So there's been quite a bit of attention happening at the provincial level on what's driving some of the rural homelessness growth as well, and how is that connected to what we're seeing in urban centers around those larger encampments that are dominating the headlines you might have seen. So to give you context, locally, the most recent 2021 enumeration found 117 people experiencing homelessness in Haldimand, Norfolk, but this was a 48% rise from the previous count in 2018. This is expected to rise to 150 by 2026 as well. So they're not the big numbers that you see in Toronto, but the concern is the upward trajectory. And there's arguments whether we're getting better at enumerating, our outreach is getting better. Either way, the point here is that there's real numbers, and one is too many, of course. But can we get a better sense of what the trajectory is and what we might do about it at the local level, given what we can and cannot do within our current resource constraints? What you're looking at here on this image is, of course, the numbers I just referenced on the left-hand side, why this matters now, but putting that into a bigger context around projections for Ontario as a whole when it comes to homelessness. So this is data that Haldimand Norfolk participated in providing at the provincial level with the other service managers, 47 service managers. And what we did here is took that data and spun up different scenarios based on a downturn. So the economy impacted by tariffs, impacted by other uncertainties as well, impacting our ability to give people meaningful work that keep up with the cost of housing, etc. The steady as she goes, it would be nothing major changes in public policy nor the economy. It's kind of what you saw last year is what you continue to get for the next 10 years, which seems to be less and less likely with the trade wars looming. And then the upturn would be hey, if things go well, we're ramping up our affordable housing builds. We're on the up in terms of GDP growth, immigration numbers, and economic performance is doing well, relatively well. That's the upturn. So the takeaway to note here is that all the numbers, sorry, go back to that slide, Jill. All those numbers are going up. So the bigger consideration is how do we prepare that even in a upturn economy, our numbers are likely to increase. That's why that 150 over the next 2 years for this community is very much realistic. So landscape of growing pressures. I have one more context around rural communities. You can flip now to the next one, Jill, that says rural communities. Yeah, perfect. So the other consideration here is, as a mostly rural community, and I know those are tricky terminologies to agree on, but what we're seeing is that rural communities' homelessness rates are actually growing faster than urban centers. So why is that? How is that happening? It's all questions we are asking ourselves as well from a data science and research perspective. There's hypotheses as to why this is happening, one of them being that the social and housing infrastructure needed to mitigate risks is not in place because there hasn't been the same level of investment in rural communities as there has been in other communities. So it is absolutely a consideration for you as you wheel and deal some of the funding envelopes and what's coming in rural communities versus those bigger urban centers. Yes, they have the absolute numbers, but you have this faster growth. Why is that happening? As I said, and you can flip to the next one, the growing pressures on homelessness supports are not to be surprising to anyone. So the limited affordable housing supply, cost of living increases, longstanding poverty, transportation barriers, especially this is really, really relevant in rural communities where transportation to areas that have supports to mitigate those homelessness risks is just not as readily available. The public access isn't there the same way you have in bigger centers. Mental health and addictions crisis, that has been a crisis that's has known no regional bounds as well. So all of these challenges have culminated to increase the risk exposure for sure. Now, let's flip to the local continuum and what's been happening locally in terms of the response from HNHSS. So let's flip to the next one. And what you're looking at here is is a
I'm sorry.
diagram that's,
I don't
yeah.
think we have quorum now.
Oh. Oh, okay. What does that mean for
So-
me? Should I just keep going?
No. So we have to end our meeting, unfortunately. I am very sorry.
That's okay. We'll try again.
We appreciate your efforts, really, we do, and appreciate the presentation. But we do have to adjourn this meeting, so thank you.
Reschedule? Okay.
Yeah,
no
we'll have to
problem.
reschedule. The staff will reach out to you. Sorry about that.
Oh, no worries. No worries. Nice to meet everybody. We'll
Yeah,
see you
nice
next
to
time.
meet you too. Thank you again.
You betcha.
May I have a mover to adjourn this meeting at 9:46 a.m.? Mover and seconder. I guess I don't have that because I don't have quorum, so we have to adjourn the meeting. Thank you.
Okay.